Welcome back to the show, Mark.
Thank you. Excited to be here.
So in our previous episode, we touched upon how myofunctional therapy can be applied to adults. What sort of improvements can we expect from myofunctional therapy in adults?
Well, I think patients, it's extraordinary. We see such enthusiasm because they start to feel results right away. So they feel less sleepy during the day. They feel like they've had a better night's rest. Maybe even we get feedback from spouses. They hear less snoring. They're less likely to kick their spouse out of bed.
So they both start to sleep better.
They both start to
Two for
sleep
one.
better. Absolutely. Everybody's happier in the
Right.
house. But for instance, in 2015, there was a meta-analysis, which has wound up, I think, being at the top of the most cited research papers from Macario Camacho on myofunctional therapy and obstructive sleep apnea. It's a group out of Stanford, and Mac Camacho, Klee Kushida, who's head of sleep there. And this was a very exciting paper because the meta-analysis showed in the existing literature a reduction in the apnea-hypopnea index by 50% in adults, and I think about 63% in children.
Wow.
And so this is just with the exercises, the treatment, the myofunctional therapy. This is, not with CPAP, not with mandibular advancement device, but these things can be used together for a great outcome. But these were results, we see these kind of results, and we even do better than that. There's an increase in the oxygen saturation. This is powerful. You've got more oxygen in your blood when you're sleeping, when you're awake. This is something that can have profound outcomes, not just on sleep apnea, but sleep apnea, upwards of 1 billion people suffer from. The American Thoracic Society, Lancet, a number of journals have recently come up with that number. This is a huge portion of the world's population. And if we can intervene early in life with children, we can hopefully prevent the onset of sleep apnea. But in adults, we can have great outcomes, lowering the AHI, increasing oxygen saturation, increasing the validated tools of assessing their daytime sleepiness level.
What about some of the techniques that a normal regimen looks like with myofunctional therapy?
Sure. This is a really important question because myofunctional therapy is an emerging field of medicine. There's all kinds of people applying it in small degrees, and then there are people who are very sophisticated, who go through a great course of training, and they have very sophisticated tools and regimens that they help their patients with. So you've got to be careful when you go on that investigation process and get a good team and do some research. And a typical course of therapy might look like perhaps we want to see 6 months to a year. Some people might try and cut corners, but really what we're fundamentally looking at is neurological re-education. It's not localized in the muscles or in the bone structure, the jaw, the craniofacial morphology, but we're re-educating these autonomic functions and postures. And so it takes time. We start to see stability and consistency after about 100 days.
And how do we do that? How do we provide that stability, consistency?
So someone might meet with a myofunctional therapist. It could be a speech pathologist or a dentist, a dental hygienist, an occupational therapist who's trained in this. They'll meet with their clinician typically maybe once a week for the first 10 weeks or so, and then things will start to spread out maybe once every other week, and then there will be follow-up visits to ensure stability. Right. And a patient will be given a course of exercises to get specific objectives, like working on lip seal, or working on getting the tongue up to the palate, or working on exercising the pharyngeal wall.
What are some of these exercises?
Well, I also want to let people know they should be careful. They shouldn't just go shopping for exercises on YouTube because you want to work with a team that's well trained. You might need to have an orthodontist involved,
Right.
an ENT, to make sure you can breathe nasally. There's no blockage in your nasal passages.
So it's pretty interdisciplinary.
It's very interdisciplinary. Fundamentally, it has to be. And you might do exercises where you pull on a button on a string. You could have a bite block in there and make sounds. Caw, caw, caw. You know, there's a bird exercise where that, to make that sound with a bite block between your teeth, you're going to have to elevate the back of your tongue.
Wow.
And this will also have an effect of kind of tightening the back of your throat, your pharyngeal wall.
And so these exercises that you're doing, how do they actually affect one's breathing and improve their sleep apnea?
We work on establishing nasal breathing. For us, that's a primary objective. If you're breathing through your mouth, your tongue is going to be on the floor of your mouth. So it's going to be closer to closing your airway, which is what we call an apnea. And so that's one of many different features. It's not just about the tongue, it's about the interplay with the tongue and the back of the throat, the upper pharynx, and really, you know, occlusion has a lot to add to this. And so working in an interdisciplinary team is essential.
So as somebody that struggles with sleep, where does myofunctional therapy fit into my current regimen?
That's a great question. Myofunctional therapy in the United States is an emerging field. And I think the academies might look at it as an emerging adjunct therapy, something that might be part of co-treatment, or something that may be in use if another form of treatment is not wanted by the patient. Results, there are studies. CPAP adherence improves. They get better results. We see people who have mandibular advancement devices, oral appliances, and they get better results. They feel comfortable. There's less titration. They you know, this kind of co-treatment is so strong. So if they're working with a sleep physician, talk to them. Talk to their dentist. Talk to a sleep dentist. People who work in this area, we think this is absolutely complementary and can help support a team approach to dealing with sleep apnea. People get better results, lower AHI, higher oxygen saturation, and better quality of life, better, you know, feeling with their daytime sleepiness.
All right, great. Well, thank you for coming on to the show.
Oh, it's exciting to be here.
Great. The sleep professionals in this video series teamed up with Whole U to spread healthy sleep education across America and were paid for their appearances.